Is your heart doing well, or is it having a little problem? Today, I will discuss the 7 signs that appear in your body and can indicate that your heart is not 100%. We know that cardiovascular disease is the #1 cause of death in the world. So stay tuned! I'm going to divide this video into 3 parts. The first part is about the 7 signs, the ones you can see that there's something wrong. What you should pay attention to when looking for heart problems. The second part will discuss the 7 classic symptoms. How do you feel when your heart doesn't go well? Are you or a family member feeling this? In the end, I'll give you precious tips on how to avoid heart problems in the future. It's a complete video, so stay until the end. I'm sure there's a lot you've never heard of. But first, you're already enjoying the video because the more people like it, the more YouTube distributes it to people who don't have access to doctors or hospitals. Also, share the video with your friends and family. Many lives can be saved with your help, so share it there. And tell me, do you have a heart problem or do you think you do? What part of the world are you from? Write it down there. Come on! What are the 7 signs you should be aware of that could indicate you have a heart problem? 7th sign, Frank's sign. Starting today, you will look at people's ears more carefully. I'm sure about that. Why? Because there is a little sign in the ear that can indicate that the person has some blockage in the heart arteries, coronary arteries or carotids. Seriously? Truth. Back in the 1970s, Dr. Sanders Frank noticed that many of his patients with angina and chest pain had a diagonal crease in the ear. He described that sign as Frank's sign. What is the connection between the heart and the ear? One theory is that the same factors that damage the intima of the arteries can also cause this crease in the ear. Does everyone who has that Frank sign have clogs? No. Among 100 people with this diagonal crease in the ear, 30 have nothing. It's just an age mark, but 70 do. And the younger the person, the more likely it is to be a sign of coronary or carotid obstruction. So if the person is 40 years old and has Frank's sign, we must be more attentive than an 80-year-old, probably because of age. And the sensitivity of that signal is low. That is, out of 100 people with heart obstructions, only 40 will have this sign. So you can't celebrate if your ear is flat. 6th sign, hair loss on legs. Loss of hair, first on your shins and then on your thighs, could be a sign that you have peripheral artery disease, that is, clogged arteries in your legs. And since atherosclerosis is not a localized disease but a diffuse one, if you have a blockage in the arteries of your legs, you may have blockages in other arteries in the body, including the coronary arteries, which supply your heart. Most people who have peripheral arterial disease only realize something is wrong when atherosclerosis is advanced. And why do they lose their hair? Because hair follicles need nutrients for their hair to grow. They need good circulation. If fatty plaque builds up in your arteries, you won't get adequate blood and oxygen. 5th sign, xanthelasma. You may have looked into someone's eyes and noticed a yellow patch on their eyelid. This is called xanthelasma. It doesn't hurt. It's usually just an aesthetic problem that grows slowly. Xanthelasmas are the most common type of xanthema, a cholesterol deposit in the skin. It is more common in middle-aged women and is mainly located in the inner corner of the eye, most often in the upper eyelid. About 50% of patients developing xanthelasma have dyslipidemia, either high cholesterol or triglycerides. And see how interesting, only 1% of people with high cholesterol have xanthelasmas. However, researchers have found that having xanthelasmas increases the risk of having heart disease, heart attack, and stroke. 4th sign, arch senile or senile halo. As the name implies, it concerns age. It is more common in older patients. It is caused by cholesterol deposits on the edge of the cornea, which have a white or gray appearance visible above and below the outside of the cornea. In some people, this halo can take over the iris, the colored part of the eye. The person may notice that they previously had a dark eye and are now getting lighter. The arch senile does not affect vision and does not need treatment. But there's a catch! If this senile halo occurs in younger people before age 45, it could signal that the person has severe dyslipidemia, that is, very high cholesterol or triglycerides. In this case, it is associated with an increased risk of heart disease. If you are elderly and have a senile arch, it is normal. About 60% of people over 60 have it. After 80, it's almost 100%. So don't worry if you're over 60. Look in the mirror and find the senile arch. 3rd sign is cyanosis. Is that bluish or purplish coloration in the skin? Could it be that it's too cold? Yes, but it could also mean that you have a heart or lung problem. If an area of your skin is cyanotic bluish or purplish when you're hot, it could be a sign that that part of your body isn't getting enough oxygenated blood, which is red. It could be that an artery is clogged. Now, if the person is complaining of shortness of breath, it could be a lung problem, pneumonia, emphysema, a pulmonary embolism, or heart failure. when the heart can't pump enough oxygenated blood. Second sign, ulcers. Those sores that don't heal on the legs or feet could indicate poor circulation. It could be due to arterial insufficiency or some obstruction in the artery that irrigates that area. Usually, people won't be able to walk very fast because their legs get tired and painful, or they may even have cramps. These ulcers are usually painful, but if you have nerve damage, such as diabetic neuropathy, you may not feel pain. Arterial ulcers usually appear on the outside of the leg and on the heels of the toes and do not usually bleed. The other ulcers are venous, which are the most common and involve varicose veins or venous thrombosis. Unlike arterial ulcers, venous ulcers affect the inner part of the leg and usually bleed. First sign, swelling in the legs, ankles, and feet. This swelling, or edema, in the legs and ankles can be caused by a weak or enlarged heart that allows fluid to accumulate in the body. You may feel like your shoes don't fit anymore, like tighter sneakers. The ankle is fluffy, looking like bread baking. When you press it, it makes that dimple, what we call a locker sign. You are more likely to notice this swelling in your legs and ankles later in the day because gravity increases the pressure on your leg veins. Lying down and elevating your legs also reduces swelling. And what are the 7 symptoms you feel you may have a problem with your heart? The first symptom you should be aware of is shortness of breath or dyspnea, especially when you exert yourself. It is a disproportionate tiredness to the efforts. You get more breathless with everything you do. It could be a heart problem. The second symptom is a persistent cough with white or pink phlegm, which means fluid in your lungs and alveoli. It's important not to let that cough go. Look for a doctor. Third symptom, shortness of breath when going to bed. The person starts to put on more pillows to see if they sleep better, but over time, they can't lie down. They have to sleep in a chair. You can also wake up suffocated during the night, which is called paroxysmal nocturnal dyspnea. The fourth symptom is generalized weakness, tiredness, and difficulty in everyday activities such as shopping, climbing stairs, carrying groceries, or walking. This is because the heart cannot pump enough blood to meet the needs of the muscles and tissues of the body. The fifth symptom is nocturia. When you wake up, you have to wake up many times at night to pee. This is called nocturia. It has several causes, but if the heart is not pumping correctly at night, this excess fluid needs to be eliminated. The sixth symptom is intermittent claudication. When you walk a few meters, you feel pain in the calf. It's not pain. Time is when you make an effort, and when you stop, it gets better. This symptom means the blood is not getting there as it should. When you stop, it gets better, but when you walk, it hurts again. Seventh symptom, chest pain. If you have chest pain, the first thing you should think about is a heart problem. You can't think it's muscle, gas, or anything simpler. Could it be? You can, but you always have to exclude the most severe thing. Cardiac pain is chest pain or discomfort that lasts longer than a few minutes. It can come and go, and it can be pressure, heaviness, tightness, or burning. It may radiate to the left arm, neck, back, jaw, stomach, and elbows, and may or may not have sweating, paleness, nausea, and associated dizziness. If you have these symptoms, you need to see a doctor as soon as possible. And now, how to prevent it. How to prevent you from having a heart problem. 1. Do physical exercises. Get out of your chair. Do not stop. Physical activity is very important for circulation, heart, and mental well-being. Low-impact exercises such as walking, cycling, and swimming can also improve the flow caused by chronic blockages in the veins and arteries. 2. If you smoke, stop smoking. Smoking is one of the worst things you can do for your health. Smoking causes impotence, inflames all your arteries, and forms fatty plaques, increasing the chance of heart attack, stroke, and dementia. 3. If you are overweight or obese, lose weight. Excess weight raises your blood pressure, worsens blood sugar, inflames, and strains the heart, kidneys, joints, and venous system, increasing the risk of thrombosis. 4. Eat healthy foods. Lots of fruits and vegetables, fiber, whole grains, olive oil, and little red meat and processed foods. 5. If you have a family history, especially your father, mother, or siblings who have a heart problem, like heart attack, stroke, stent, or heart surgery, you should be more attentive than other people. If many people in your family suffer from heart problems, you have to have more in-depth examinations. 6. Take care of your cholesterol and triglycerides. Eat more oats, cut trans fats and saturated fats, lose weight, eat more fiber, and exercise. Even if you do everything right, you can't reduce your cholesterol, so don't be upset if your doctor prescribes medicine. 80% of cholesterol is made by the liver. Even doing everything right, sometimes it's not enough. 7. Keep your glucose under control. If you are diabetic or pre-diabetic, controlling your glucose levels will reduce complications. Glycated HB has to be below 7. 8. Lastly, control your blood pressure. Your goal is to maintain a blood pressure below 120/80. For some, the target may be less aggressive, like no higher than 140/90. Of course, if you think you have a heart problem, if you've seen several signs, and if you have some of those symptoms I've just mentioned, look for a doctor, explain to him, and follow his guidelines. Thank you so much for watching, and feel free to like, share, and subscribe to our channel for more informative content. If you have any questions, please leave a comment below. Remember to share so that more people have this knowledge. And what will be the following video you'll watch? I'll leave 2 recommendations here on the side. Stay healthy, stay happy!